Have you ever looked down at your feet or ankles at the end of the day and noticed that they seem much larger than they did in the morning? Maybe your shoes suddenly feel tighter. Maybe your socks leave deep marks around your ankles. Or perhaps you press your finger into your lower leg and notice that the skin stays indented for a few seconds. Sometimes this is simply the result of standing for too long, sitting for hours, eating a very salty meal, or being out in hot weather. But sometimes swelling in the legs, ankles, or calves can be a sign that something else is happening inside your body, and that's why you shouldn't automatically ignore it. In today's video, we're going to look at 8 important warning signs associated with leg, ankle, and calf swelling. We'll discuss common causes, fluid retention, circulation, veins, medications, lifestyle factors, and some potentially serious situations that require medical attention. Most importantly, we'll explain how to recognize the difference between ordinary temporary swelling and swelling that deserves a medical evaluation. Let's begin. What exactly is leg swelling? The medical term for swelling caused by excess fluid in the body's tissues is edema. It can happen when fluid moves out of your blood vessels and collects in the surrounding tissues. This can occur in your feet, ankles, legs, hands, or other areas of the body. One simple clue is called pitting edema. If you gently press a swollen area with your finger and an indentation remains briefly after you remove your finger, that can be a sign of fluid accumulation. But not every type of swelling produces a visible indentation, and not every swollen leg means there is excess fluid. Injuries, inflammation, infections, vein problems, medications, and other conditions can also cause swelling. That's why the pattern matters. Is both legs swelling? Is only one leg swollen? Did it happen suddenly? Is there pain? Is the skin red or warm? Does it improve overnight? These details can provide important clues. Warning sign number 1. Both legs are swelling regularly. Let's start with swelling in both legs. If both ankles and lower legs gradually become swollen during the day and improve after you've been lying down overnight, gravity may be playing a role. When you're standing or sitting for long periods, blood and fluid can pool in the lower parts of your body. Your veins have to work against gravity to return blood toward your heart. Inside your legs are tiny valves that help keep blood moving in the right direction. When those valves don't work efficiently, blood can pool in the veins. This is known as chronic venous insufficiency. It can cause swelling, heaviness, aching, itching, and sometimes visible varicose veins. This type of swelling is particularly common after long periods of standing or sitting. If you work at a desk all day, drive for several hours, or spend most of your day on your feet, you may notice swelling becoming more obvious toward the evening. But persistent swelling should still be evaluated, especially if it is getting worse. Warning sign number 2. One leg suddenly becomes swollen. Now this is extremely important. If one leg suddenly becomes swollen, especially if the swelling is accompanied by pain, tenderness, warmth, or redness, don't simply assume it's because you walked too much. A blood clot in a deep vein, called deep vein thrombosis or DVT, can sometimes cause swelling in one leg. A DVT can be serious because a clot can potentially travel to the lungs and cause a pulmonary embolism. That means sudden swelling in one leg should not be ignored. This is particularly important if you've recently had major surgery, been hospitalized, taken a long flight or long car journey, been immobilized for an extended period, or have other risk factors for blood clots. If one leg suddenly becomes swollen and painful, seek prompt medical evaluation. And if leg swelling is accompanied by sudden shortness of breath, chest pain, coughing up blood, fainting, or severe difficulty breathing, seek emergency medical attention immediately. Do not massage a suddenly swollen, painful leg while trying to diagnose the problem yourself. Get medical help. Warning sign number 3. Your ankles are swollen every evening. Now let's talk about a very common pattern. You wake up in the morning and your ankles look normal. You go through your day. You sit, you stand, you walk. And by evening, your ankles look puffy. Then after sleeping overnight, the swelling improves. This can happen with prolonged standing, prolonged sitting, venous insufficiency, heat, high sodium intake, and several other causes. For some people, simply moving more throughout the day can help. Your calf muscles act like a pump. Every time you walk and contract your calf muscles, they help push blood upward toward your heart. This is one reason prolonged sitting can contribute to pooling in the lower legs. If you're sitting for hours, try getting up regularly. Walk around, move your ankles, stretch your calves, take short walking breaks. These simple habits can support circulation. But if swelling is persistent, progressively worsening, or associated with other symptoms, talk to your healthcare professional. Warning sign number 4, swelling with shortness of breath. Now we're getting into an especially important warning sign. If your legs and ankles are swelling and you're also experiencing shortness of breath, don't simply assume that you're out of shape. Fluid retention can sometimes occur in people with heart failure. When the heart isn't pumping effectively, fluid can accumulate in the body. This may lead to swelling in the legs and ankles. Some people may also experience breathlessness, particularly when lying down, reduced exercise tolerance, unusual fatigue, or waking up at night feeling short of breath. These symptoms can have many different causes, but the combination of swelling and breathing difficulty deserves medical attention. If you're suddenly struggling to breathe, have severe chest pain, fainting, or severe weakness, seek emergency medical care. Don't wait for the swelling to disappear. Warning sign number 5, swelling with unusual fatigue. Let's talk about fatigue. Many people assume that being tired is simply part of getting older, but persistent fatigue combined with swelling can sometimes deserve closer attention. There are several possible explanations. Heart problems can cause fatigue and fluid retention. Kidney problems can affect the body's ability to regulate fluid. Liver disease can also contribute to fluid accumulation in certain circumstances. Anemia, thyroid problems, medication effects, poor sleep, and many other conditions can cause fatigue as well. This is why symptoms need to be considered together. One symptom rarely tells the whole story. If you've developed persistent swelling along with a significant change in energy levels, exercise tolerance, or daily functioning, it's a good idea to speak with a healthcare professional. Warning sign number 6, swelling after starting a new medication. Here's something many people don't realize. Some medications can contribute to swelling. Certain blood pressure medications, particularly some calcium channel blockers, can cause ankle swelling. Some anti-inflammatory medications can contribute to fluid retention. Certain hormones, steroids, and other medications may also cause edema in some people. That doesn't mean you should stop taking your medication. Never suddenly stop a prescribed medication because you noticed swollen ankles. Instead, tell your doctor or pharmacist. They can determine whether the medication may be contributing and whether a change is appropriate. Sometimes the solution is simply adjusting the medication. Other times, the swelling may have nothing to do with the medication at all. The important thing is to investigate rather than guess. Warning sign number 7, your skin is changing. Look closely at the skin around your swollen ankles. Is it becoming darker? Is the skin becoming tight or shiny? Are you developing itching or irritation? Are there areas that seem harder or thicker than before? Long-term swelling related to vein problems can cause changes in the skin around the lower legs. You may notice discoloration, dryness, itching, or eventually skin breakdown. This can happen when blood remains pooled in the veins for long periods. If you have chronic swelling accompanied by skin changes or sores around your ankles, don't ignore it. Early evaluation can help identify the underlying cause and reduce the risk of complications. Warning sign number 8, the swelling is getting worse over time. One of the most important questions you can ask yourself is this getting worse? Maybe your ankles used to swell occasionally. Now they swell almost every day. Maybe your shoes fit normally last year, but now they feel tight every evening. Maybe the swelling that once disappeared overnight is now staying longer. Progressive swelling deserves attention. Your body is constantly regulating fluid through the heart, blood vessels, kidneys, lymphatic system, and other organs. When something changes, swelling can sometimes be one of the visible clues. That doesn't mean the cause is necessarily dangerous, but progressive symptoms should be investigated. Why does swelling happen? Let's understand the basic science. Your blood vessels constantly exchange fluid with surrounding tissues. Normally, your body maintains a balance. Some fluid moves out of the bloodstream. Other systems help return fluid back into circulation. Your veins help carry blood toward the heart. Your lymphatic system helps drain excess fluid. Your kidneys regulate salt and water balance. Your heart helps maintain circulation. When one or more parts of this system are affected, fluid can accumulate. That's when swelling may appear. Gravity makes this particularly noticeable in the legs. That's why your feet and ankles can become swollen after spending hours upright. Salt and water retention. Let's talk about sodium. Eating a very salty meal can temporarily increase water retention in some people. You might notice that your rings feel tighter, your face may look slightly puffier, your ankles may feel swollen. This doesn't necessarily mean you have a serious medical condition, but if your diet consistently contains large amounts of sodium, reducing excessive sodium intake can be a useful part of a healthy eating pattern. Processed meats, packaged soups, salty snacks, fast food, sauces, and many processed foods can contain substantial amounts of sodium. Instead of relying entirely on the salt shaker, check food labels. Choose more minimally processed foods, eat more fruits and vegetables, and use herbs, spices, garlic, lemon, and other flavorings to make meals enjoyable without excessive sodium. The importance of movement. Now let's talk about one of the simplest things you can do: move. If you've been sitting for several hours, get up, walk around, move your ankles. Do a few gentle calf raises if they're safe for you. Your calf muscles help pump blood back toward your heart. This is sometimes called the calf muscle pump. When your legs remain still for long periods, that pumping action decreases. That's why sitting all day can contribute to swelling. If you work at a desk, consider setting reminders to stand up regularly. If you're traveling, take appropriate movement breaks when possible. If you have mobility limitations, ask a healthcare professional or physical therapist about safe exercises for your situation. Elevating your legs. Another simple strategy that may help certain types of swelling is elevation. When you're resting, you can place your legs on a pillow so that they're elevated. The idea is to use gravity to help fluid move away from the lower legs. For people with certain types of venous swelling, this can provide temporary relief. But elevation is not a cure for every cause of swelling. If you have heart, kidney, vascular, or other medical conditions, ask your healthcare professional what positioning is appropriate for you. What about compression socks? You may have seen compression socks recommended for swollen ankles. Compression garments can help some people with chronic venous problems by applying pressure to the legs and supporting venous return. They are commonly used in certain situations involving venous insufficiency and prolonged standing or sitting. But compression is not appropriate for everyone. People with certain arterial circulation problems may need to avoid or carefully manage compression. And if you have sudden, one-sided swelling, pain, redness, or warmth, don't simply put on compression socks and assume the problem is solved. Get evaluated first. The correct treatment depends on the cause. Can dehydration cause swelling? This sounds strange. If swelling is excess fluid, why would dehydration matter? Your body constantly tries to maintain fluid balance. Dehydration can affect how your body handles sodium and water. However, drinking enormous amounts of water isn't a solution for unexplained swelling. More water isn't always better. Your fluid needs depend on your health, activity, climate, diet, and medical conditions. People with certain heart or kidney conditions may even have specific fluid recommendations from their healthcare providers. So don't follow a generic internet rule telling you to drink a massive amount of water every day. Drink an appropriate amount for your individual situation. The role of weight. Carrying excess body weight can increase pressure on the veins in your legs and may contribute to venous problems and swelling. It can also increase the risk of conditions associated with fluid retention. But don't approach this as a reason to blame yourself. The goal is not to shame anyone. It's to recognize that improving physical activity, nutrition, sleep, and overall metabolic health can benefit circulation and general health. Even gradual changes can be meaningful. Walking more, eating more vegetables, reducing ultra-processed foods, getting enough protein and fiber, improving sleep. These are sustainable strategies. Foods that can support a healthier routine. There is no magical food that instantly removes leg swelling, but your overall diet can support cardiovascular and metabolic health. Focus on foods such as vegetables, fruits, beans, lentils, whole grains, fish, lean proteins, nuts, seeds, and healthy fats. Choose minimally processed foods more often. Reduce excessive sodium. Limit heavily processed meals when possible. And remember that potassium-rich foods can be part of a healthy diet for many people. Examples include bananas, potatoes, beans, spinach, yogurt, avocados, and many fruits and vegetables. But there's an important warning here. If you have kidney disease or take medications that affect potassium, don't suddenly increase potassium-rich foods or take potassium supplements without medical advice. For some people, too much potassium can be dangerous. When swelling needs urgent attention. Let's make this very clear. Seek urgent medical attention if you have sudden swelling in one leg accompanied by pain, warmth, or redness. Also seek urgent care if swelling occurs together with sudden shortness of breath, chest pain, fainting, coughing up blood, or severe difficulty breathing. These symptoms can indicate potentially serious conditions. Don't wait to see if they disappear. And if swelling is accompanied by severe weakness, confusion, blue or pale skin, or other major changes, seek emergency medical care. When to make a routine appointment. Not every case of swelling requires an emergency room, but you should consider making a medical appointment if your swelling keeps returning, it's getting worse, it doesn't improve with rest, it's affecting both legs regularly, your skin is changing, you have persistent pain or heaviness, you've recently started a medication, or you're experiencing other symptoms such as fatigue, reduced exercise tolerance, or changes in urination. Your healthcare professional may examine your legs and circulation and decide whether blood tests, imaging, heart evaluation, kidney testing, or other investigations are appropriate. A simple 7-day plan. Now let's finish with a simple 7-day routine. Day 1. Pay attention to when the swelling appears. Morning, afternoon, evening? Write it down. Day 2. Take several short movement breaks throughout the day. Day 3. Reduce heavily salted processed foods. Day 4. Add more vegetables and fiber-rich foods to your meals. Day 5. If your healthcare professional has told you that elevation is appropriate, spend some time resting with your legs elevated. Day 6. Review your medications with your doctor or pharmacist if the swelling began after starting something new. Day 7. Look at the overall pattern. Is the swelling improving? Is it getting worse? Is one leg different from the other? Are there other symptoms? This information can be extremely useful when you speak with your healthcare professional. Final message. Swollen legs, ankles, and calves are common. Sometimes the cause is simple. Long hours of sitting, long hours of standing, heat, a salty meal, or temporary fluid retention. But swelling can also be connected with problems involving the veins, heart, kidneys, liver, lymphatic system, medications, or blood clots. That's why the pattern matters. Don't panic when you notice swelling, but don't automatically ignore it either. Pay attention to whether it's sudden or gradual, one-sided or both-sided, painful or painless, temporary or persistent. And especially pay attention to symptoms such as chest pain or sudden difficulty breathing. Your body doesn't always communicate through dramatic pain. Sometimes it gives you quieter clues. A tighter shoe, a sock mark that wasn't there before, an ankle that looks different at night, a leg that feels unusually heavy. These details are worth noticing. And if something doesn't feel right, getting evaluated is always better than trying to diagnose yourself online. Medical disclaimer. This video is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any medical condition. Leg, ankle, and calf swelling can have many causes, including some that require urgent medical attention. If you experience sudden one-sided swelling, chest pain, sudden shortness of breath, coughing up blood, fainting, or severe symptoms, seek urgent medical care. Always speak with a qualified healthcare professional about persistent or unexplained swelling. If you found this video helpful, make sure to like the video, subscribe to the channel, and turn on notifications for more health and wellness content. And tell us in the comments, have you ever noticed swelling in your legs or ankles after a long day? What health topic would you like us to cover next? Thanks for watching and take care of your health.